Hello everyone, Dr. Abby here with CHIRO for Moms, CHIRO for Kids, and we are diving in to another episode, blog, topic, whatever word you want to use today, about tips and tricks on being a cash practice. So I was curious on what we haven't talked about yet. I looked back and I was like, what sort of conversations have we not had yet? So I reached out on the CHIRO for Chiro's Instagram, and one of the questions that I got was how to change the mindset of patients moving from an insurance to more of a cash-based practice. And I was like, ding, ding, ding. I love this question because they cannot be the only one that has this question. So when we're thinking about going from an insurance to a cash-based practice, I was trying to think of one word I could boil it down to. And that one word was autonomy. Oh, that's so good. Autonomy. And when we look at the two, an insurance-based practice, or one that takes mostly insurance, the insurance company gets to dictate the treatment plan. So they determine how many visits they will approve, the different modalities they will approve of, how many, what areas of the body, depending on the patient intake that they approve of. And so everything is dictated by the insurance company in itself. Whereas in a cash-based practice, it looks more at the patient. The patient gets to decide what is best for them. They get to decide what their treatment plan is in a conversation with us as the provider. So we tag team, they come do the intake, they do the evaluation, we do the treatment, and I go, so what questions do you have? And often they go, well, when do I come back? And I said, I love to check in 2, 3, 4 weeks, depending on what's going on, if they're pregnant, if they're not pregnant, if they're just postpartum, if they've it's been a while since they've been in, I'll kind of gauge it. But at the end of the day, you determine what's best for you. Whether that's in 2 weeks, 2 months, 2 years, whatever works in your schedule, I will be here for you when you need. And if they come in and they go, doc, I've got a lot of rib pain going on, I'll be like, okay, 1, let's talk about it, right? But then 2, is that what you want to focus on today? And we might spend 15 minutes of the 20-minute appointment just working on the rib cage, working through the thoracic spine, working through the diaphragm, working through the ribs, working on stretching and activation and mobility. And then, checking in again, is there anything else you want to tackle today? And maybe I'll look at the neck or I'll look at the low back. And sometimes they come in and they go, I just need everything. I just need everything tuned up. And it's like, okay, we'll see where the tension spots are. But there's autonomy. They determine what's best for them, because at the end of the day, patients know their body best. They really do. And an insurance company, it's a lot of rinse, lather, repeat. If someone comes in with rib pain, a lot of times insurance companies are going to loop them into this big circle and say, this is what research has shown. This is what you're going to do because this is what I approve. And our bodies just aren't that way. They're really not. Even the most standard patient, time and time again, is going to react to a treatment differently. Maybe on one patient with rib pain, stretching works. On another one, they need more strength. On the other one, we're going to tape and let the muscles tame down a little bit. But they all in a cash practice are getting charged the same because they are paying for time, not necessarily the spinal regions. And there are a handful of patients in the clinic that do submit on their behalf to the insurance companies, and that is always on them. We are very open about that. Is if you would like to submit to your insurance companies, you have the paperwork, but ourselves and our staff do not do that. On the back end of that, we do accept FSA and HSA, so that's often a question we also get. So if someone doesn't want to use insurance, or they're hoping to use their insurance, they might then turn to their HSA, which is also a wonderful option. But then there comes to the conversations of a patient's schedules, and now they have to cancel because they found out you're not in network and you don't take insurance. One, you just be understanding. I understand why. I totally get it. Can I send you some recommendations for in-network providers? Help them out. Find the people in your community that you refer patients to, whether it's more family care, women's specialty, more rehab, other specialties, and maybe it's PT, maybe it's a massage therapist, maybe it's an acupuncturist, maybe they're looking for a pediatric dentist for a tongue tie revision, but say, hey, can I send you some people? Are there, around what area do you live? I'd be happy to send you some people that either I know firsthand because of other patient experiences, or I myself may have been treated there previously. It can be a really wonderful way to just keep the door open and to be understanding that, yeah, I know I'm cash practice, but just because that's the case doesn't mean I don't want the best care for you. So starting to build that referral network for yourself with a multitude of providers all over, if you're in the Twin Cities, all over the metro area, because you just never know where people are traveling from, can be a really, really beneficial way to kind of make that transition from the insurance to the cash practice be a little bit more smoothly. And just reminding your patients who might already be established in your clinic that the reason you're making this transition is so that they have more control of their treatment plan, of the care that they're getting. The care they're receiving isn't changing at all, but you can tailor it however you need it to be that day. If my neck's feeling great, maybe I don't want it adjusted, and that's okay. Give the autonomy to your patients first. That is kind of like the big over under. And then the last thing I'll say about that, the only last thing that's kind of on my mind is just being really open about it on your webpage. So however you are marketing, just being very clear on your website. We are a cash-based practice. We're open to having, if you do have questions, please ask where you want to have the answers for you. But the worst thing to do is to surprise someone with the cost of something. So being upfront about your prices. If you're offering modalities, what are the prices of your modalities? And then if you are insurance and you want to stick with insurance, just being really mindful that each plan is really different. And so reminding patients that they do need to know what's included in their plan and what's not. And if that's the best way to make that transition, is like, we just want to make everything equal. So no matter when you're coming in, what you're coming in for, you're always getting the care that you need, no matter where or what we need to use to get there to make you feeling good. It's just a flat fee across the board. So I'm hoping that helps answer that question. And if there are more questions on this topic, please leave it in the comments below. I'm happy to answer all of those questions. And just remember, autonomy. At the end of the day, that's what it comes down to. Subscribe. We're always looking to be posting more content for you guys. And other than that, have a wonderful evening and let us know what you need next.